And it's really simple to implement. It could take 5 to 10 minutes and at the end of practice. And that alone, I think, helps reduce a lot of issues.
You're listening to iTeachOverseas podcast with your host, Daniel Mendez.
Welcome to the iTeachOverseas podcast. Whether you're currently teaching overseas or considering the idea, my mission for this podcast is to celebrate, educate, and entertain our international community. Join me as we discuss current issues and trends in international schools, as well as meet some amazing people from around the world. I had the pleasure of interviewing Jared Maisel, who's a certified athletic trainer working currently at Concordia Shanghai. He has worked as an athletic trainer at the U.S. collegiate level in such sports as football, tennis, softball, soccer, rugby, and field hockey. He also got an opportunity to work with the Philadelphia Flyers organization of the National Hockey League. This is his first international school posting, and as you will hear, he knows his athletic training at the youth level and is passionate about bringing his health and wellness knowledge to international schools around the world. In the past 4 years, he's made tremendous strides in improving the safety of athletes in the APAC conference, and you'll hear how Jared saves his school a lot of money each year. He will also share a lot of great resources with us that I will link in the show notes, iTeachOverseas.com/103. And if you listen to the end, Jared has an important message for all international schools. He's a great guy and looking for a new adventure next year. Maybe one of our listeners can help him out. Before we begin the interview, here's the episode's iTeachOverseas tip. This tip comes from Glynis Ogden from Shanghai American School. When looking to book a rental car for a 6-week summer vacation in North America, you may find it cheaper to book 2 separate car rentals during that time. Many car rental companies have great deals on monthly rates, so you would need to book a separate 2-week car rental to get you through the rest of your vacation. If you have an iTeachOverseas tip to share on this show, go to iTeachOverseas.com or send me an email at info@iTeachOverseas.com. We're here with Jared Maisel, athletic trainer and wellness coordinator for Concordia Shanghai. Thank you so much for being here, Jared.
Thank you for having me. This is a really nice project you have for the international school community.
What is an athletic trainer? For those of us that don't know what an athletic trainer is out there, what is that? Are you a personal trainer?
Yeah, there's a big difference. Sometimes it's misunderstood. Even the term athletic trainer, it's a little deceiving. Athletic training is an allied healthcare profession that specializes in the prevention, evaluation, management, treatment of sport-related injuries. The difference between athletic training and personal training is that personal training is not really a protected healthcare profession. Anyone can call themselves a personal trainer. There's many different credentials they can get. There's many different certifying organizations out there. Some of them are very good. Some of them are maybe not so good. Whereas a certified athletic trainer, there's only one way to become a certified athletic trainer. You have to go to undergraduate program that has athletic training that's approved by the credentialing board to be a program of certified athletic training. You have to do clinical hours. You take courses on first aid, concussion management, rehabilitation, orthopedic evaluation, and then, yes, some strength and conditioning aspects because of the unique population we're working with. These athletic populations, they have demands that are above and beyond kind of the normal everyday Joe that maybe sprained their ankle or they hurt their knee or they have a bad back. Our population of young, healthy, athletic people is a kind of above and beyond kind of what we would consider kind of normal. So it requires a kind of specialized profession. So I really like to think of it as like training as kind of like an orthopedic doctor, physical therapist, and also kind of like a EMT, kind of all rolled into one. All those professions, they're obviously great and they're very high level. This athletic training profession has pieces of all those professions kind of rolled into one that can be employed directly at a school institution, a university, a high school, a hospital, a physical therapy clinic, orthopedic clinic. That's where you find us. Also see us on when you're watching the NFL, watching football. Those guys running onto the field for those injured football players, those are athletic trainers.
I feel like you're the first responders for a sport setting. Like I feel like there's a lot of signs that you look for in athletes to see whether they are really injured or if they are concussed. I do value that aspect of your role. You know what kind of injuries you're noticing in our student athletes at all?
We see a lot of the kind of lower level types of injuries here, meaning that, minor ankle sprains, medial tibial stress syndrome, which is also shin splints, patellofemoral pain syndrome, bicep tendonitis. I feel that a lot of these injuries stem from a general lack of foundational skills in their sports they're participating in. A lot of these students, especially, grades 7, 8, 9, it may be their first time playing basketball, baseball, volleyball. Sometimes they'll lack the general athletic skills and strength that's needed for their sport.
We had the APAC volleyball tournament here a few weeks back, and you were treating some student athletes. What were some of the injuries that they were having there at that tournament?
We had a few minor ankle sprains. Those are quite common, especially in volleyball, when they coming down and landing on like a teammate's foot. Those types of things, there's not much you can do to prevent it besides, possibly putting a brace on it or something like that. But a lot of the things like the overuse things, like bicep tendonitis or patellar tendonitis, also known as jumper's knee, these things could be prevented with appropriate flexibility built into their athletics program with their training as they participate in volleyball, the appropriate stretching, the appropriate mobility exercises, and landing techniques, appropriate squat pattern. These are all things that a lot of time can be handled on the front end with participation.
I heard flexibility, strength training. If there was one thing that schools and coaches could potentially focus on right away, what could they take away from listening to you today?
Especially in this age group, I was saying like the grades 6, 7, 8, 9, around there. This is also a period of time of rapid growth. These adolescents, this is when they reach their growth spurt. I see it clinically that, sometimes I'll see a kid in the fall and then I'll see the kid again in the spring and then they look like two different people because they've grown 6 inches.
Right.
During this period of time of rapid bone growth, the muscles and tendons and the ligaments surrounding the joints don't really keep up with this rapid bone growth. And they'll go from having normal, in the fall, I look at their hamstring, their calves, it's all looks pretty good. Then this rapid growth happens and all of a sudden everything's wound up. They lose the hamstring flexibility, they lose the calf flexibility. Then this has the impact, biokinetically, if you don't have the appropriate flexibility to do a proper squat pattern, jump for a rebound in basketball or running mechanics wise, there's going to be a breakdown somewhere. In this age group, I think the mobility and flexibility aspects are huge on the preventative side with athletics at this level. We started doing that here at Concordia when I first came here. I really helped the coaches and the PE teachers get them educated on foam rolling, also known as myofascial release. It's a technique. Think of it as you have the muscle and the fascia for your thigh muscle or for your calf muscle. And some of those areas can get wound up. They could be knotted. And think of like a sweater that's wrinkled. And the foam roller, by doing kind of self-massage on themselves, can really iron out some of those issues that stretching alone can't do. Stretching is great. We're going to increase range of motion with that. But really, the self-mobilization of the foam roller has really profound impacts and quick results. That alone can really knock out the patellofemoral issues and the shin splint issue very quickly.
How much time are we asking? Is this, a half an hour of foam rolling? Is this before every game? Is this after every game? Tell us, what would be the ideal?
Typically, foam rolling aspect, it can be pre or post practice or activity, whatever training session it may be. I like it the best at the end because it also helps reduce soreness as well, pushes some of the fluids that naturally will occur after we work out, kind of helps push that back to the body. So I think it's best afterwards, and the static stretching as well. I think that's all best afterwards. And it's really simple to implement. It could take 5 to 10 minutes and at the end of practice. And that alone, I think, helps reduce a lot of issues. And then certainly on the front end of a practice, a dynamic warm-up with some balance exercises and working on specific motor pattern, whether it be, side shuffling or landing strategy, squat pattern, whatever it may be, or high knees, butt kicks, all that stuff. Certainly that on the front end is very helpful in preventing acute injuries.
Most of these teams have played, maybe 1, maybe 2 games during a week, but now flying 2-3 hours to go do an APAC tournament. Now they're playing 6 games in a day or 6 games in a weekend. What are some ways that we can help increase their stamina or increase their flexibility throughout a tournament like that? What are some things that we can do there?
In our conference, we have roughly 4 practices a week, each of them about 2 hours, and then we'll have 1 or 2 games a week. I'm speaking very broadly about basketball and volleyball. And also, specifically with volleyball, we'll play best of 3 sets, the first 2 sets to 25, and the third set to 15. So that's a pretty short match. Then all of a sudden we go to APAC, we're playing 2 or 3 matches where it's best of 3 to 25. So all 3 sets are to 25. And then even the last couple days, they may play best of 5 sets. So we've had a pretty short season, six weeks roughly, of only practicing, maybe 4 times a week. At other schools, it's even less. Maybe they only practice 1, 2, 3 times a week. And then we're asking a lot out of them for these tournaments because, the kids, the families have paid the money to go to these conference events, and we want them to get good value. We want them to have fun and enjoy. I completely understand that. But I see it sometimes when we host events, day one, a visiting team will come to me and say, yeah, my shoulder's been bothering me all season. What can I do about it for this tournament? And unfortunately, I'm not a magician. I can't just, Mr. Miyagi, rub my hands together and make something happen. Like I was saying before, handling things on the front end is obviously always the best thing. And I've brought it to the attention to some of the conference reps and our coaches, just bringing up this topic of, are we asking too much of these students at the end of the season? It's inconclusive at the moment. It'd be great, as a conference if we could look at statistics, but I think it would be really progressive and really great at the conference level if we could look at, are we asking too much out of some of these athletes towards the end of the season? It would vary by sport. And some of my colleague athletic trainers have looked at some of these numbers specifically with rugby and presented that to some of the athletic directors, some of this injury data due to possibly some of this lack of development, these injuries. And it's up for discussion as far as, possible changes or ways to improve student safety.
I really hope you're enjoying this episode of I Teach Overseas. Let me know what you think by going to iTeachOverseas.com. International schools might be considering getting an athletic trainer. What are some other duties that you have?
So athletic training gives a really great skill set that can be really helpful to an international school community. Yes, we're good on the injury side, managing it, rehabilitation, all that. But there's many other ways that we can contribute to the community. Here at Concordia, it's kind of a unique, progressive role that has kind of developed during my time here. My additional responsibility is wellness coordinator. So for me, I'm doing the day-to-day logistics of handling the high school and middle school student-athlete injuries. But in addition to that, I'm also handling injuries for the teachers. I'll see teachers before or after school during their prep time to take a look at their injuries and doing rehabilitation, treatment, whatever it may be. This aspect has been really good because it's happy, healthy teachers are better teachers. So reducing sub time, they don't have to make an appointment to the doctor and skip school. They can see me anytime. in addition to that, so that's kind of the injury rehabilitation side. On the wellness kind of side, I'm meeting with staff one-on-one to talk about general health issues, nutrition, general fitness, getting them oriented into the gym, showing them basic flexibility and stretching techniques, foam rolling. And also I coordinate. We have some teachers and outside parents that actually teach some group fitness classes. So I help, just make sure that they have facility space available, and trying to maybe even bring in more instructors to allow more offerings for the teachers to stay healthy. And in addition to that, I'm doing some health promotion programs. Like actually right now we are in what I call the Concordia Fitness Challenge, in which teachers form teams. It's free to participate. And the goal is to just increase our overall activity level. It could be walking, cycling, in the gym, working out, hiking, anything like that. And for 4 weeks as a team, in our teams, we try to increase all of our activity. And then at the end, I award prizes to make it fun and give a little bit of motivation to the teachers. And actually in a few weeks, I'm actually bringing in an outside group to teach a cooking class. Even some teachers I've worked with here, I met with one-on-one. It's interesting that some have just missed the train on how to do some basic cooking techniques, preparing a healthy meal at home, giving them the skills to do that. It's an interesting role. It's been really nice and progressive and supportive by administration here and at all divisions. And I think it could really be implemented at other international schools to help with a variety of things. It helps with student recruitment. When a possible family comes to check out a school and they know their student is going to be interested in athletics, the student safety side is covered. You have someone on site that's setting policy, putting a concussion protocol in place, that's there for the first aid. So that's a great selling point as far as student safety. And then on the teacher recruitment, we as international schools, we obviously want really good teachers. So a school that supports not only the teacher, professionally, but also personally and health-wise. Here's a position that you get access to as a teacher, as an employee, that can help you with any questions you may have or any improvements you want to make in your eating plan, even tips relating to helping with sleeping. I serve as like a liaison to some recreational clubs here. So if someone's interested in, volleyball, I may have a contact to help them out and get them active and involved in the community.
Do you have a success story, like an example of transformation that maybe in a short time or a long time here?
On the teacher wellness side, we have seen exponential attendance in our group fitness classes. So I think just from the top-down support from the administration has really promoted some of the offerings that we have here and expanded some of those offerings that we have here. From year one to now, this is my 4th year here, we have seen our group fitness and general fitness center time in the gym, we have seen it grow 3-4-fold in my time here. And on more the athletic training injury side, I have kept track of some data on the patients that I'm seeing and how much time I'm saving the teachers from taking time off from work to go to, a physical therapy clinic. And we are seeing reduction in costs and saving some money in health insurance and time off. We're seeing some trending towards that way.
So are there any places our listeners can go to that gets more information? I know not every school has athletic training. Are there some websites that we could go to get some more information?
As an athletic trainer, I'm very passionate about my profession. There is a website called atyourownrisk.org. So it's a little play on words. It's atyourownrisk.org. And on that website is a lot of information about student safety that's good for parents, coaches, and international schools to take a look at, looking at providing some evidence on school safety and ways that some policies that can help improve things. It also talks about athletic training and all the skills that the profession can contribute to a school. I think one aspect that all coaches and PE teachers and other athletics participants can educate themselves on. So there's two organizations that are really good at general health and fitness, strength and conditioning. One is called the National Academy of Sports Medicine, NASM, and the other one is National Strength and Conditioning Association, the NSCA. And both of them offer a variety of certifications and really good programs that coaches and PE teachers can get themselves educated on to implement some preventative general fitness and strength and conditioning aspects into their respective program. And then lastly is actually the CDC, Center for Disease Control.
Oh, really?
Yeah, especially on the student safety side. They have a great campaign called the Heads Up campaign for concussion awareness, and they provide free information and data on concussion information and how schools can best serve their students by keeping them safe and also reducing risk for the school, reducing their liability. So that's kind of on the injury side.
Awesome. Thank you so much. We'll be right back.
If you're enjoying this podcast, there are so many ways you can help support. Just go to iTeachOverseas.com/support and find out how you can get involved. If you're not enjoying the show, then go to iTeachOverseas.com website and tell me why. I would love to hear from you.
What does the next 5 years look like for you? What do you want to be doing?
I hope it's kind of conveyed that I'm very passionate about athletic training. We're very saturated as a profession in the U.S. Odds are, if any listeners have coached in the U.S. or worked in a high school, they've probably worked alongside an athletic trainer. So we're very well represented on the student safety side in the U.S. But I really see being here in Shanghai, here in Concordia, was my first experience to the international school community. And I got to say, it's fantastic. Great education, great resources. It's a really good working environment. And I think athletic training is really underrepresented in the international school community. You know, in my opinion, if a school is providing an athletics program, there's a risk there for injury. A school should do something to take care of that. If you're providing the avenue for that to occur, you should be responsible for that. So I think an athletic training role at these international schools can really help risk mitigation for these international schools by setting up some policies and concussion protocols and emergency planning for what's in the best interest of the student. So I think the reason I came over to here is to kind of help represent my profession and help the profession grow internationally. So I think I would like to really continue doing that by continuing to educate on the athletic training profession, continuing to educate on student safety, concussion guidelines, emergency planning guidelines. I'm actually heavily involved with a organization here that we just started called Certified Athletic Trainers of China. It's CATSI, so a nice acronym there. We are about 15 to 20 certified athletic trainers here in China and in the region, and we have really laid the foundation to organizing our profession out here and helping these international schools do better on the student injury side. You know, we want kids to be safe. That's our number one goal. Just recently, my group CATSI gave APAC concussion management guidelines for host venues when they host an athletic event, how they should take care of a concussion. And just recently, that was approved at the athletic director level to be implemented. And in addition to that, the athletic directors voted that they want athletic trainers in every single APAC school. This is huge for student safety and athletic trainers in the region. So hopefully that approval goes forward and we can see some improvement on some of these areas at these international schools.
So how could international schools reach out to you and talk to you about these things? How can they reach you?
I'd be happy to have my email in the show notes. It's jared.maisel@concordiashanghai.org. Like I said, I'm very passionate about the profession. I moved internationally to help advocate for my profession. The way it's implemented here at Concordia is one way of doing it. There are many different ways that an athletic trainer can holistically be involved in an international school, whether it be in respect to even teaching or assisting the nurse or an administrative assistant. There are many different roles that an athletic trainer can fit into an international school. I've advised a few schools on these types of topics, and I'm absolutely happy to talk to anyone about that.
Well, it's been a pleasure having you on the podcast, and I'm looking forward to seeing how athletic training can help impact some of these international schools out there. So I really appreciate your time with us, and good luck.
Happy to be here. Thank you.
I'm Daniel Mendez from iTeachOverseas podcast. Thanks for listening.